Now I am going to discuss a somewhat rare form of arrhythmia, escape echo bigeminy. There are various types of bigeminies there, and we'll have a short discussion about the other types of bigeminies after the initial ECG discussion. One look at this ECG tells you that is severe bradycardia. Now we'll see what is the cause of bradycardia. There are no regular sinus P waves seen anywhere. No sinus P waves are seen. And the first beat, which is marked as J, is a junctional escape beat. After a short interval, you see a negative P wave in lead 2. Negative in lead 2 means that the activation is spreading away from the inferior leads, that is upwards. So an activation spreading upwards is not a sinus beat. In sinus beat, you expect the activation from above downwards towards the inferior leads. So negative P wave in inferior leads cannot be a sinus P wave. So this is something special in this case. This junctional beat travels up along the AV node into the atrium and produces a retrograde activation of the atria, which causes a negative P wave in inferior leads. And then what happens is that this gets conducted back into the ventricle, producing a QRS complex. This is what we call as an echo beat. This junctional focus is being echoed from the atrium back into the ventricle, and this sequence continues. So this is what is known as escape echo bigeminy. Junctional rhythm. There is no sinus rhythm activated seen here because no sinus P waves. You would have expected upright sinus P waves. Even if it is sinus bradycardia, you would have seen some P waves. So sinus activity cannot be seen. Whatever you are seeing is junctional escape beat. And this is not a junctional ectopic beat. In case of junctional ectopic, that should be premature. It should come before the expected sinus activity. Here it is not that. Sinus is not there, so junction is escaping. And this is a echo beat. Junction atrial echo beat into the ventricle. So overall, this qualifies for a rare diagnosis of escape echo bigeminy. These are the important mechanisms of bigeminy: escape capture bigeminy, echo bigeminy, which we have just seen a case of escape echo bigeminy. It is not escape capture. Then block bigeminy, ectopic bigeminy. This is the commonest which you see in most ECGs. It could be a combination of a normal beat followed by a ventricular ectopic or a junctional ectopic or even atrial ectopic. So any type of ectopic can occur in ectopic bigeminy, but commonest bigeminal rhythm would be ventricular ectopic bigeminy. One sinus beat followed by a ventricular beat, then a pause, again sinus, again ventricular ectopic beat. That is the commonest variety of ectopic bigeminy, though you can have atrial ectopic bigeminy and junctional ectopic bigeminy. Then what is this escape capture bigeminy? We have seen escape echo bigeminy. Escape capture, instead of the second echo beat, you will have a sinus beat. In patients with sinus bradycardia, after a particular interval, junction escapes, producing a QRS without a preceding P wave, that is the junctional beat. We have seen an example of junctional beat in the previous ECG, and the next beat will have a normal sinus P, which is upright in inferior leads. Then it is called as escape capture bigeminy. Echo is junctional escape followed by echo from the atrium without involving the sinus node, having inferior leads with the negative P waves. Block bigeminy is something which is seen in conduction disturbances. Suppose there is 3 to 2 AV block, 3 P waves followed by 2 QRS. Then it is block bigeminy. You can have block bigeminy at atrial level also. That is, when 3 sinus impulses come, only 2 are conducted to the atrium, then it is 3 to 2 SA block, which produces bigeminal rhythm. Then also the both P waves will be there, but in between there will be a pause, which will be exactly twice the sinus cycle. So block bigeminy can be at the AV nodal level or SA nodal level. Then another probability for block bigeminy is when you have atrial tachycardia or atrial flutter with 3:2 conduction. Then also you will have block bigeminy. Usual block bigeminy is sinus rhythm with 3:2 conduction into the ventricle through the AV node.